Today we're taking your hip and knee mobility up a notch with 5 advanced stretches.
That's right. These stretches will help improve your hip mobility, and they feel real good. I can talk to that as a participant.
And let's cue the catchy intro song.
What's that supposed to mean? Oh, that, yeah.
Bob and Brad.
You can't, yeah, he can sing. He's a tenor.
Soprano.
Bob and Brad, the 2 most famous physical therapists on the internet.
I'm Brad.
I'm Mike, and behind the scenes we have Bob, and together we are the most famous physical therapy team on the internet.
There you go, in our opinion, of course, and please subscribe. There you go. Hey, now I do want to mention, these are advanced hip stretches. They are a little more difficult than a lot of that we do, but if you're a senior like myself, I guess I'm a senior now, you can certainly try these, but be careful, be cautious if you have not stretched your hips a lot. So take your time with them. If they create pain, you do not do them so aggressively. Take your time. Some of these will not be for you. Maybe 1 or 2 of them is going to help you out. So keep that in mind. And we look at the hip joint, and it's a ball and socket joint, and it actually has great amount of movement, and the capsule and the tissues around here can actually tighten up, limiting that hip motion, and that can start problems like arthritic pain and just stiffness pain. So we're going to show you how to really keep it moving.
Now, these stretches, you have to be able to get on and off the floor comfortably. Also, if you've had a hip replacement, you're probably not going to do most of them. If you have the flexibility, no precautions, I guess you can check with your physician first, but they are a bit more aggressive than your typical hip stretches.
Yeah, I would like to say, anytime I worked with patients that had a hip replacement, say a year or 2 before, I'd make a phone call to their surgeon. Typically, you can just talk to the nurse of the surgeon because the surgeons are hard to get a hold of, and they can confirm whether or not if you have any precautions at that point or not.
Now, the first stretch is called the couch stretch. You can do it with your back foot on a couch or up against the wall. It's just going to change the angle of your foot. If you're doing it on the wall, I like something padded. I do this at home, and then you put your foot up on the wall like this, and then you kneel in an upright position. The further I am away from the wall, the easier it will be. The less upright I am, the easier it'll be. The closer your knee gets to the wall, the more extreme it will feel. And you're getting a lot of hip flexor loosening up and ankle mobility and just a whole bunch of stretching. And this,
what are you reaching up for?
I'm just getting a little bit of side stretch in there, but you don't have to. And hold this for 30 seconds on one side and make sure to switch and do the other side. My right ankle I just injured the other day in Frisbee, so it's a little tender. So this side I can get up a little bit easier right now.
Yeah, actually it does look a lot more.
Yeah, because my ankle's a little tight on that side right now.
Yeah, well, we should have a video on that. But I do want to mention, if you're doing this on a couch, and would you agree, Mike, it's actually more comfortable because
it's a little
your foot
easier.
Your foot sinks
so
into the
if this was
cushy.
a couch beneath behind me here instead of, oh my
wow,
goodness.
that's a roll-around couch.
rolling
I'll
couch.
hold it. If this was a couch, it'd be like this, and it's nice and cushy. It doesn't have to be a couch. It could
So
be a
it's
nice solid
less
chair.
of a stretch on your ankle joint if that's what's giving you the issue there.
Move the furniture, whatever, is up against the wall if it has a tendency to slide, and you'll be fine. One word of caution. I know I'm always afraid to do this because it does put your hamstring at a tendency possibly to get a cramp if you're one of those crampy type people in the hamstrings, and that's no fun. So keep that in mind, because show them what you're going to do if they get a cramp in a hamstring.
Well, you're going to want to get up and then stretch your hamstring out, which usually just standing up can be painful, and then you try to get it straight again.
Yeah, one way or another, straighten your knee. I know I just go down on the floor and try to straighten it and then lean into it like that to stretch it and eliminate it. And then I don't do that stretch for a while.
Now, stretch number 2 is just a deep body weight squat hold. So you're just going to go into a squat position and hold it for 30 to 60 seconds. Now, if you look at me, I don't have the best ankle mobility, so I can only go this far. However, if you feel unsteady, you can hold onto something like a railing. And now look how much further I can get into this depth of a squat and hold it there for 30 to 60 seconds.
Are you saying that your heels should maintain contact or no?
Yes, I am saying your heels can maintain contact. If you struggle with ankle mobility like I kind of do, you can either use a book, a slant board, some little wedges like this. And notice now, normal squat, I get this far. Take my ankles out of the equation. Look how much further I can get down, and I can sit here all day. It's pretty easy. You can slowly work on getting rid of these heel wedges, but just because I've had past injuries, they're kind of permanently limited.
So, like, if you take a cushion or a book or a 2x4, 2x6, you can use that. And yeah, I can see that actually feels a lot better on myself because when I don't have it, I'm floating and my balance is less. And for those, if you got a trailer with some chucks that hold the wheels, they'll work well. Because
very large door stops. What else you got available?
Yeah, there's a lot of things that you could improvise for those.
Yeah, firm book, but that's just an option that really opens up the hips. Again, if you can't get down in this position safely, then just don't go down as far. Just do what depth you can or hold on to a railing. Especially if you're older and have limited mobility and you're trying to work on it, you can just kind of work on your squat depth a little bit. As you feel more comfortable, you can try to get a little bit lower. So that's option number 2.
Yeah. It really makes it, just holding on to something lightly makes a big difference on balance.
The next one, number 3, is the 90-90 hip stretch. So we're going to have a lot of 90s here.
Yeah. So let's explain to them a little bit why it's called 90-90.
So I have a 90-degree angle here, and I have a 90-degree angle here. Some people, depending upon their hip anatomy, can get way more upright than I can. I get about this upright, and that is it. I have some tightness on this side. My femurs tend to rotate out, so that's why that struggles for me. And you could try playing with this. You can either try going straighter up, or you can try going forward, and you're just going to hold this for 30 to 60 seconds. You're going to get a nice, good stretch, but you have to make sure to reverse it.
Yeah, make sure you go the other way. Myself, I don't do this one very much. The biggest reason my hips tolerate it, but my low back to get up tall like this is not comfortable. It's one of those things that it's creating some pain. Red flag. Don't do it. Find something else to do. I got spondylolisthesis in my low back. You may have stenosis or something like that, which may make this uncomfortable. Just go to the next stretch.
And everyone's going to be a little different. This feels fine for my front leg on both sides because I have good rotation that way. But however, my back leg is tight on both sides. So I have to push myself up more to stay here. So just play with it a little bit. Hold it 30 to 60 seconds on each side, and you can do it a couple times a day.
And if you're starting out, hold it for 15 seconds and build up. You don't have to go for 30 to 60.
I did have a patient tell me that, and we were stretching his calves the other day.
What did he
30
say?
seconds seems like a long time. So we did 15 seconds.
There you go. I'm glad you were nice.
Now, the next one has a couple different names. Some people do it in yoga. Ben Patrick does it, who's knees over toes guy. So what you do is go into a downward position like this. You can be on your palms or your fingertips, and you're going to push your heels down into the ground, but you're going to alternate. You're going to get a nice hamstring stretch and a calf stretch and try to keep a nice back. Some people are going to be way out here, and some people can really get up tall. I personally can't get too close because I have some limited flexibility.
Yeah. Me personally, and probably a lot of people that are 50 or older, are not going to go on your fingertips because there's a lot of stress. I used to do these push-ups in karate, I was 25 years old, but it isn't happening anymore.
So yes, a flat palm works fine.
Yeah.
Just go more forward and push one leg back on the other. With this one, you can do time if you like. I kind of like reps. So I like to do 5 to 10 reps on each side, just kind of warm up those hamstrings and calves.
It feels like you're getting ready to come out of the blocks on a 100-yard dash.
Kind of, yeah. You're getting ready. If you want to sprint out of it, go ahead, I guess.
No, it's a nice one. I like that one.
Now, the last one is a lunge. There's some more advanced versions of this. So Ben Patrick, like I mentioned earlier, calls this the ATG split squat. There's lots of
ATG? What is that? Is that an acronym?
I don't remember what it stands for, but yes, it is an acronym.
All together good. There you go.
Sure.
All together good.
Anyway, what you want to do for beginners is start with your foot elevated on something and use rails for support. And you're going to work on, this is a bit more knee and hip flexibility, just driving your knee over your toes to really stretch into it and then come back. Some people, if you have painful hips or knees, you just start real basic like this. He had his mom do this, and she's in her 60s or 70s. She's up there, and she can do this just fine.
60s is up there?
Yeah,
Come
for me it is
on.
right now. Anyway, you work on progressing to more depth and more depth. If this becomes easy on a stairway or elevated, you can start doing it just with support without holding on, working on your knee over your toe. Stretches your back hip flexor a lot. Make sure to keep a nice upright posture and just drive forward. You can get your heel off the ground if you want, because we're focused more on your knee and your hip movement, and just make sure to do both sides.
So I could do it like this, right?
Yeah, I guess if you're a real beginner, you can, yeah.
Because this is how I do mine regularly. I really like this stretch this morning. I did it before I went running. And I add the noodling on that. Who calls it that?
Kelly Starrett.
Kelly Starrett. He's another famous physical
This
therapist.
is what I like to do before and after running. I just go and I do...
You do it afterwards too, huh?
5 or 10 reps. I get a nice stretch in my back hip and I get my knee moving.
I'm too tired after I run to do it.
It just feels good.
Yeah, it really does. It's a go-to. So as you can see, for myself, there's 2 of these I really like and I do. That one I mentioned, it didn't take me long to decide it's not for me. So you can do the same thing. Go through them all, pick out the ones that feel good.
Yeah, so try them all out. Again, if you want to check out more videos on some stretching, click the video link on the screen. It's actually a follow-along video, more for beginners if these seem too hard for you. It's a video with Jordan, so you can follow along and do it. She uses a chair to help.
She is
Pretty good.
much better than us. She looks more pretty, and everything's better about Jordan. Anyways, we can fix
She has
just
more hair?
Yeah.
Okay, anyway.
Yeah, maybe she could help us fix the broken heart syndrome.
Perhaps,
There
but
you
I
go.
don't know.
Well, we're not getting too
let's
far
ask
at it,
her. I
but we'll
haven't
keep
talked to her
trying.
for a
Yeah.
while. Okay.
Carry on. We got to go to work.